During the COVID-19 pandemic, at-home tests became a convenient tool for many households across the country. As healthcare landscapes continue to change, the demand for at-home diagnostic tests is reaching new levels. More consumers than ever are now comfortable with self-collection samples for different reasons. According to the healthcare and medical device company Abbott, 97% of medical supply chain professionals have seen an increase in demand for home testing since 2021. The at-home testing industry is expected to be worth about $2 billion by 2025. For more, let's bring in CBS News reporter Nidia Cavazos. Nidia, good to have you with us. What are some of the main drivers behind the rise of this do-it-yourself movement?
John, we're talking about a booming industry when it comes to the at-home test. There are several companies, including Silicon Valley startups, that are offering Americans tests ranging from tests that offer binary results, positive and negative, from COVID pregnancy tests up to cancer screenings, Alzheimer's, ADHD, some STDs as well. And they're overall offering Americans an alternative to the conventional medical process. We're often told to go to the doctors when we have a health issue. We spend hundreds, if not thousands of dollars trying to find a diagnosis. But with these startups, they're trying to offer Americans an alternative. And now, one of the most important factors here, and probably the most important underlying factor, is that there continues to be a lack of access to affordable health care. So this leaves everyday Americans trying to, find an alternative, and hence these at-home tests. So
people are trying to do it themselves when they can't afford it. But how does that blur the lines between what they would normally get, and are there consequences? When I say normally, I mean blur the lines with medical care, and what are some of the consequences of maybe depending too much on these home tests?
Well, I talked to a medical expert this morning, Dr. Irigel from Brooklyn, and he sort of walked me through, the pros and cons to these at-home tests. And on one hand, while, it is we can welcome innovation and new ways to find an answer to these health issues, he also walked me through some of the consequences and just overall cons to these at-home tests. And this includes, of course, that Americans are going to be paying for these at-home tests. They're going to get results, but oftentimes these results are often complicated and may not be easy to interpret for the everyday American. And they do require some sort of, degree of medical expertise to be able to understand. And a lot of this also stems from, the distrust that many Americans have with their doctors, with an inability to be able to get a diagnosis on time and treatment that is actually affordable. So while this doctor does welcome this innovation, he does remind us that we need to take precaution whenever there's some type of innovation. He reminds us that there's always predatory players and who might be trying to sell the everyday consumer with tests that are not necessarily needed and are far away from the actual problem.
Nidia Cavazos, thank you so much for your reporting.
Thank you, John.